have fluid away from the macula also, and they remain asymptomatic. So the CSR patient will remain subclinical as long as the fluid does not touch the fovea. Otherwise, they can have fluid outside the fovea for many years, many months. They can have many recurrences, but they remain asymptomatic. So, what is CSR is a collection of serous fluid in the macula. That is the exudative serous fluid in the macula. So, previously what we used to believe is that the RP is the cause of the CSR. That the RP is not functioning properly. That's why the fluid is collecting in the subretinal space. So now what we believe is that the choroid is the seat of the cause of the disease. These patients of CSR are having a particular phenotype of choroid where there is a chronic choroidal hyperpermeability. So there is a hyper flowing blood in the choroid. There is a hyperpermeable choroid. So because of high constant blood flow in the choroid, there is a breakdown of the barrier of the choroid, and then there is a excess fluid which is collecting. When the RP cannot keep the retina in a dehydrated state, that is the time it is dysfunctioning, but the cause is at the choroid. So once the choroid RP cannot any longer keep the fluid from the retina dry, then the RP becomes focal leaks develop in the RP because of focal RP dysfunction, and the the fluid from the choroidal tissue, that is what is exuding from the choroidal vasculature, gets access to the subretinal space. So that is what we believe today is the pathophysiology of CSR. So the other concepts which are related to CSR is what is called as the pachychoroid. Pachychoroid means what? Pachy means thick. So in these subset of patients of the phenotype of the choroid, these patients have got thicker choroid than normal. So because they are having hyperpermeability of the choroid, and this hyperpermeable choroid can cause many diseases. CSR is just one of them. So when the choroidal hyperpermeability is there and there is a focal or diffuse RP function, and the only thing the disease does is to manifest by exuding fluid in the subretinal space, we call it as CSR. So because of this choroidal hyperpermeability, sometimes the VEGF levels are more. They develop neovascularization and they develop CME. So this is also a part of the pachychoroid spectrum. So we call it as pachychoroid neovasculopathy, which is a subset of AMD patients. Or you can just see AMD-like changes. You can have pigmentary alterations, drusen and other. So that is called as pachychoroid pigment epithelium. So if you see the choroidal thickness of patients, the outer limit is around 395 microns, subfoveal choroidal thickness. So in some subset of the population, the thickness of the choroid is more than 395 microns. So these are called as pachychoroid. So this kind of pachychoroid phenotype can predispose these patients to multiple diseases which will manifest in different ways. So it can be polypoidal choroidal vasculopathy, a form of wet AMD, CSR, or just pigment epitheliopathy. What every changes what you see on the fundus is not dry AMD. It could be something other pathology also. So when you measure the thickness of the choroid and you see this kind of changes, you will call it as a pachychoroid pigment epitheliopathy. They look something like dry AMD. And the distinction is that in wet AMD and dry AMD patients, the choroidal thickness is normal. So when you have a choroid which is thick and you have something like a CME or some other diseases, they are actually the spectrum of diseases falling in the pachychoroid. So they are called as a pachychoroid spectrum. So CSR is a disease which is a pachychoroid spectrum. So initially the patient can present to you with like a CSR, and later on the patient can develop the neovascularization. So patients of CSR can, wet AMD or a pachychoroid neovasculopathy can manifest to you as a CSR. So every CSR patient can develop sometimes a neovascular membrane also. So this is the current concept. So this is one of the patients of PCME, the pachychoroid neovasculopathy. You can see that the subfoveal choroidal thickness in the other eye is 409 millimeters microns, and it has got a thick choroid. So this is not a classic AMD. So wet AMD patients have got a normal choroidal or